The Frontier and Rural Medicine, or FARM, program at the USD Sanford School of Medicine is a program to prepare medical students to work in rural areas, and Susan Anderson is the director of FARM.
The Frontier and Rural Medicine program, or FARM as we like to call it, is a unique experience for a select group of medical students to live and work and train in a rural community in South Dakota for 10 months of their medical education.
FARM's first class was 2016, and they started with only 3 rural communities with 6 students. FARM then saw how impactful this program was to rural communities.
Over time, the number of sites has grown and the number of students involved has grown. So with the class of 2026, there will be 8 communities involved and 13 students.
Students are introduced to the FARM program their first year and can apply. Anderson says they are selected a year in advance before heading to a farm site. And for Maria Koenen, who was selected and worked in Parkston, South Dakota last year, that experience was invaluable to her.
And for me, it meant that I got to experience rural medicine from inside it. I got to see everything as it is, and I got to learn from rural providers who have been living the rural medicine life for a long time.
Anderson says FARM helps the students acquire many skills with the benefit of helping many patients in rural communities.
We want them to get a broad breadth of experience, and we hope that that adequately prepares them to thrive when they go on to residency.
The doctors get to know you so well that they trust you to do things that you would never get to do at a big site. The medical experience is unmatched as a medical student.
During her time in Parkston, Koenen won the Outstanding Community Project Award, which is sponsored by the South Dakota American Family of Physicians for her community involvement in educating about concussions.
And I just had a lot of fun with it, and it was a wonderful way to get involved in the community, and I ended up winning an award for it, which was really nice.
It's special for the student, and we want to recognize that they put time and effort to, not only benefit their education, but also benefit the local community that has hosted them.
They both say the FARM program is a benefit to rural communities as well as keeping those medical students in South Dakota.
Ultimately, the goal is that they're going to appreciate the rewards and the challenges of practicing in a rural community, and maybe someday consider coming back and practicing there for themselves.
I'm actually very actively interested in returning to that area to work as a general surgeon someday, and I'm forever grateful that I got chosen to be a FARM student, and I'm thankful for what Parkston and the FARM program did for me.